For half the population, it's a fundamental, unavoidable part of life, yet it's a topic we often just don't talk about enough. So today, we're going to demystify menopause and really break down this huge biological transition step by step.
Okay, so what exactly are we talking about here? At its core, menopause is simply the physiological end of female reproductive life. But the most important thing to get right off the bat is that this isn't a disease or some kind of disorder. It's a completely natural, universal biological process.
And you'll often hear this number, 51. That's the average age for the final menstrual period. But here's the thing. That number is just one single point in time, a landmark, on a journey that actually starts years before. All right, so here's our game plan. First, we'll tackle what menopause actually is. Then, we'll dive into the great hormonal shift behind it all. After that, we'll look at how the body responds right away. Then the long-term health stuff. And finally, we'll talk about managing the transition.
Okay, let's jump right in. What even is menopause? And probably the biggest takeaway here is that it's not like flipping a switch overnight. Nope, it's a journey, a process with a few distinct phases. And it all kicks off with something called perimenopause, which usually gets going around age 45.
So this whole journey really kicks off with perimenopause, right around age 45. What's happening is the ovaries are just becoming a little less sensitive to those hormones, which is why cycles can start to get a bit, well, irregular. Then you've got the final period, which on average happens at 51. But here's the key part. Menopause isn't officially diagnosed until a full year has passed with no periods at all. That 12-month mark, that's the clinical definition everyone goes by.
So what's the engine driving this whole process? Well, it all comes down to a massive hormonal shift. And if you can get your head around this part, you'll understand the why behind pretty much everything else.
And really, this entire story is dominated by one main character, estrogen. The drop in the amount of estrogen circulating in the body is the primary driver of, well, pretty much everything we associate with the menopausal transition. To really get this dynamic, I want you to think of your body like a house with a thermostat. So before menopause, you've got high levels of estrogen. This tells the brain, hey, everything's good. We're at the right temperature, no need to send out more stimulating hormones. Those are FSH and LH, by the way. But then as menopause approaches, estrogen levels start to drop. The brain's thermostat goes, whoa, it's getting cold in here. And it starts cranking up the heat, pumping out way more FSH and LH to try and get the ovaries to kick back into gear. So in more scientific terms, what's happening is that the drop in estrogen removes what's called negative feedback on the brain. Without estrogen there to say, hey, chill out, we're good, the pituitary gland just keeps shouting, go, by pumping out more and more of that FSH and LH. It's a command the ovaries just aren't really listening to anymore.
All right, so we've seen what's happening on the inside with the hormones, but how does that actually feel? Well, now we're going to look at the ripple effect of that change, the tangible physical symptoms that so many people experience.
And just how big is that ripple? Get this, 75%. That is a staggering number. 3 out of every 4 women experience hot flushes. It's probably the most well-known symptom for a very good reason.
And all of these symptoms, they're a direct result of that estrogen level dropping. Take hot flushes, for example. They happen because estrogen plays a huge role in regulating the brain's temperature control center. It gets thrown off kilter. And then you have the urogenital system. Tissues there really rely on estrogen, and without it, they can start to thin out and get drier, which can lead to discomfort and, unfortunately, a higher risk of things like UTIs. Okay, so beyond those immediate symptoms, it is absolutely vital to understand the long-term health picture. And this is all about the loss of the protective role that estrogen has been playing throughout the body for decades. Let's kick things off with bone health. You can think of estrogen as a guardian for our bones. It actively puts the brakes on the cells that break down bone. Those are called osteoclasts. But when estrogen levels fall off a cliff, that protection just vanishes. The breakdown process speeds up, you get an accelerated loss of bone density, and that leads to a much, much higher risk of fractures and osteoporosis. And you know what? It's a really similar story when it comes to heart health. Estrogen provides this incredibly powerful protective effect. It helps manage cholesterol, bringing down the bad LDL and bumping up the good HDL. After menopause, that protective shield is gone, and a woman's risk of cardiovascular disease actually starts to look a lot more like a man's. Okay, so we've covered the what, the why, and the long-term impacts. Let's switch gears and get practical.
How is this all diagnosed, and what are the options for managing the transition?
So, how do doctors actually confirm it? Well, it's often done with a simple blood test. And hey, remember how we talked about the brain sending out way more FSH when estrogen is low? Doctors can measure that. A really high level of that follicle stimulating hormone, or FSH, is a clear biological signpost. It just confirms the whole hormonal story we've been telling.
Now, the primary treatment for managing symptoms is hormone replacement therapy, or HRT. And honestly, this is a big decision that's all about weighing the pros and cons. On one hand, HRT can be incredibly effective. It gives real relief from things like hot flushes, and it helps protect against osteoporosis. But on the other hand, it does carry a modest increase in the risk for certain cancers, blood clots, and even stroke, especially for women over 60. This is exactly why it's so critical to have a really thorough, personal conversation with your doctor.
So, here's the bottom line. Menopause is a biological certainty for half the people on this planet, but our understanding of it, that doesn't have to be uncertain. Knowing the why behind the physiology, the symptoms, the long-term effects, it empowers every single one of us to have better conversations and to make more informed decisions about our health. So the question we want to leave you with is this. Now that you know, what's the most important part of this story to share with someone else?